Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Zafar. You seems quite in distress. May I know what happened? What is bothering you? Mm-hmm. Okay. Mm-hmm. And tell me more. I'm very sorry to hear about that, Mr. Zafar, and I understand that how painful situation would be for you. So, Mr. Zafar, um, and can I offer you any painkiller if you are in severe pain? Mm-hmm. Is it okay with you, Mr. Zafar? Right, Mr. Zafar. So to better understand your condition, I need to ask you a few questions. Is it okay with you? Mm-hmm. All right. Mm-hmm. So, Mr. Zafar, since how long you have pain in your flank? Since 2 hours. Okay. Would you like to add something to it? Mm-hmm. Okay. Can you tell me if pain is the specific site of it radiates to another area? Okay. Mm-hmm. Okay. And can you describe the character of the pain? Okay. Um, if it is associated with nausea, vomiting. Mm-hmm. Okay. What do you think? What aggravates your pain, Mr. Zafar? And what relieves? Have you taken any medication for this pain? Mm-hmm. Okay. Mm-hmm. And how about your urine, Mr. Jafar? If there is any burning maculation? Mm-hmm. Okay. Any frequency? Mm-hmm. Okay, Mr. Jafar, so may I know how severe is your pain on the scale? If you talk about 0 to 10, and the 0 is none and 10 is maximum. All right. Can you tell me if there is any episodes of similar complaint in the past? And do you have a fever along with that? Mm-hmm. Any pain on right side of abdomen? Mm-hmm. Which radiates to your shoulder? Okay. If it is um, uh, radiating to a back? Okay, Mr. Zafar, can you tell me if there is any history of trauma to back? If you notice any unilateral one-sided rash on your body? Mm-hmm. All right. Any history of urinary retention? Mm-hmm. Any discharge? Okay. If there is any forming of urine? Mm-hmm. Okay. And how about your bowel habits, Mr. Zafar? Okay. Have you noticed any blood in urine? And notice any significant weight loss? Mm-hmm. How about your appetite? Mm-hmm. Right, Mr. Zafar. If you had any history in past and in childhood, okay. Mm-hmm. Any past history of stones? Okay. And do you have control on your urination? All right, Mr. Zafar. What do you do for a living? Mm-hmm. Okay, Mr. Zafar, I'll ask you more personal questions, okay, to better understand. Is it okay with you? Mm-hmm. Okay, Mr. Zafar, so do you smoke? Mm-hmm. Okay. How much cigarettes per day? Have you ever tried to quit this habit? I appreciate Mr. Zafar, and we talk in detail in next appointment. So, Mr. Zafar, have you noticed any darkening of your skin? Okay. If you become short of breath? Any swelling of legs? Right, Mr. Zafar. Do you have high blood sugar, high blood pressure? If any immediate family member suffering from a renal disease, any stone, and do you have any pain in your big toes? What sort of diet you like the most? Okay. All right, Mr. Zafar. How about your water intake? Okay. If you are taking any medication so far, prescribed by doctor or over the counter? All right, Mr. Zafar. So how this disease has affected your life? I'm very sorry to hear about that, and I understand Mr. Zafar, and you need not to be worried. I'll try best of our abilities. Okay. In order to confirm my diagnosis, I need to examine you. Is it okay with you? If you are in severe pain, I can I'll cancel examination. Thanks for your cooperation, Mr. Zafar. So I'll sanitize my hands, and then I'll inspect his tummy, and then I'll look if there is any scar, any deformity, any bulging, and then I'll palpate his kidneys bilaterally, bimanually, and I'll check if there is any tenderness right line, flank, and I'll palpate his bladder, and I'll percuss if there is any full bladder, and I'll check for rebound tenderness in right leg fossa to exclude appendicitis and cholecystitis. And so, Mr. Zafar, if you are undergone an investigation so far, right, Mr. Zafar, what I have gathered from the information you have shared with me, okay, and from the examination, and I came to the conclusion that most probably you are having a condition what we call in a medical terminology is renal colic. Okay, so do you know anything about renal colic? You need not to be worried, Mr. Zafar. I'm here to explain everything to you, okay? So most probably your problem is related to your kidneys, okay? And there are channels carrying urine from kidneys to waterbed, called a urinary bladder. Okay, but I think that there may be some obstruction, okay? So in these channels causing pain, maybe it could be due to some stone, if it makes sense to you, Mr. Zafar. Yes, Mr. Zafar. So for that, I need to refer you to emergency department, to urologist, okay, right away. Okay, would you like me to call any ambulance for you? Yes, Mr. Zafar, to get treatment on time, it is necessary to refer to ER, okay? And besides that, I'll give everything in written format, okay? And in ER, a doctor may offer you some painkiller called diclofenac 75 mg IM, okay, to relieve your pain, if it makes sense to you, Mr. Zafar. Yes, Mr. Zafar. So till ambulance comes, ambulance arrives, would you like me to inform your family? Yes, Mr. Zafar, ER department is only 20 minutes away, okay? Yes, Mr. Zafar. So let me inform your family members, okay? And then I'll offer to establish IV lines, okay? And take some samples, okay? This will save yet time in ER. How it sounds to you, Mr. Zafar? Yes, Mr. Zafar. At ER, if you need a surgery, okay, it will be done as soon as possible, okay? And it you'll be given anesthesia, okay? So you will be asleep and will not feel any pain, okay? If it makes sense to you. Yes, Mr. Azafar, sometimes it's possible to treat with medications, okay, rather surgery, but your specialist, that is urologist, will decide it whether you should go for a surgery or any treatment. Okay, so whatever will be suitable option for you, okay, if it makes sense to you. Mm-hmm. Yes, Mr. Zafar, you need not to be worried. I'll continue to take care of you once you are recovered from this condition. Okay. Okay, Mr. Zafar, here is a leaflet. Okay. It includes all the information regarding your condition. I hope it will be helpful for you. Okay. I wish you a speedy recovery. Okay. Take good care of yourself. Bye-bye.